But we begin with the Speaker of the House, Nancy Pelosi. As I say, throwing down the gauntlet today, saying that whether the Senate likes it or not, whether Maine's in the spotlight Senator Olympia Snowe likes it or not, whether conservative Democrats like it or not, whether or not it gets called Nazism or fascism or whatever scares you-ism on right-wing television, when all's said and done, there is going to be a public option in the final health care bill. At least Nancy Pelosi says so, at least in the House. She said if the Senate wants to take the public option away, they're going to have a fight on their hands.
The need for a public option is very clear, and as I have said, our House bill will have a public option. If you're going to mandate that people must buy insurance, why would you throw them into the lion's den of insurance industry without some leverage with a public option?
In the House, where Nancy Pelosi is in charge, the Democratic majority is so big that they can not only pass a bill without a single Republican vote, they can pass a bill even if 39 Democrats join every single Republican in voting against it. So is there going to be a public option in the House? I don't bet, but if I did bet, I would bet that there would be. In the Senate, Republicans are expected to filibuster, meaning they will try to block the Senate from even getting to vote on a health reform bill. And that is the real nitty-gritty single factor that may actually determine what kind of health reform we get, and especially whether or not it includes the controversial public option. It all comes down to this. Will Republicans block an up or down vote on health reform? The Republican minority in the Senate is so small that they can't block the vote on their own. There are only 40 Republican senators, and it would take 41 votes to block the legislation. This means for this all-important procedural thing, Republicans can only block a vote on health reform if they get help in doing so from at least one Democrat. And that's never happened before. All the procedural rigmarole on health reform can be hard to follow, and we've been following it for months now. But it comes down to this. If there were an up or down majority rule vote on health reform, including the public option, it would probably pass the Senate. The only way it could be stopped is if Republicans block a vote. And the only way Republicans can block a vote is if they get a Democrat to help them do that. If they get a Democrat to join with them to block the vote. If they get a Democrat to filibuster with them. Now, a number of influential blogs on the left, like Firedog Lake and Daily Kos, recognized this rather early in the debate as a critical factor as to whether or not health reform passes. And they have raised now a useful point. If there is a single instance in Senate history of a senator voting to filibuster against his or her own party which would otherwise have been able to block that filibuster, if there is a single instance of it in history, nobody can find it. Again, I'm not a betting person, but if I was, this information would make me more likely to bet on health reform passing and a public option being part of what passes. It would make me more likely to bet on that, to know that a Democrat would have to do something that extreme, that historically unprecedented, in order to side with Republicans to kill it. Joining us now to tell me just how naive I am about these things is Minnesota's senior senator, Democrat Amy Klobuchar. Senator Klobuchar, thank you for coming on the show.
Well, thank you, Rachel. It's great to be on.
I understand that you have a cold as well.
Yes, but your voice is sounding good.
Oh,
You're
it is?
hanging in there. I think so.
You can actually discern what I'm saying? All right, well, has there been discussion within the Democratic caucus in the Senate about this prospect of Democrats crossing over and filibustering health reform with Republicans?
I don't think there's been that discussion because people are very focused on getting something done here and getting competition. And as you know, there are different interpretations of what the public option could look like in the Senate. There's talk about state by state. There's talk about opt-in, opt-out. I don't necessarily view this as a bad thing. There's a difference between the Schumer version and the Rockefeller version. But the bottom line is the Democrats in the Senate want a bill. And they want a bill that's going to make health care more affordable. I always tell people, remember just three numbers. There's so many numbers here. 6, 12, 24. 10 years ago, average family paying $6,000 a year for their premiums. Now, $12,000 a year, with many people paying more. 10 years from now, if we just put our heads in the sand, $24,000 a year for the average family in America. People can't afford it. And that's why this idea of getting something done in the Senate, there is unanimity on that. Is there differences on some details? Yes. But I think in the end, people will stand together to get a bill that's focused on bringing costs down for American families, that's focused on putting some strong rules in place for the insurance companies that they can't kick people off just because they have a sick kid, and that's focused on allowing Americans still to have that kind of choice they want with their doctors.
So in terms of your vote and where you see the Senate Democrats, broadly speaking, you think that the status quo is so bad that your bias is toward voting for some sort of change. There has to be something that's going to make some improvement. Some bill is better than no bill. Are there bright lines for things that you would vote no?
Well, I first of all want to see some cost reform with Medicare, and I think this is tied in with the public option, because for a lot of us who want to see a competitive option, we also know that we have to do something about Medicare rates to see that kind of reform. Medicare is going to go in the red by 2017. So if you're a senior that's 65 years old and you want to stay on Medicare till you're 95 and live a good quality life, you don't want Medicare to go in the red. And that's why taking some of these cost models that are good that are in the Senate bill, where they say, okay, let's not have all these hospital infections. Let's reward hospitals that aren't having a bunch of readmissions. Let's do something about bundling and integrated care so you can have one primary doctor and a team of doctors working together. So one study showed that if some of the hospitals, especially in some of the more inefficient parts of the country, followed that Mayo Clinic model, we could save $50 billion every 5 years for high-quality care. And it's so counterintuitive. People don't realize the highest quality states have the lowest costs. And so putting those kinds of cost reform in Medicare has to go hand in hand with these reforms. And I know that there are people that find that common ground in the Senate, and that's why I think we're going to get something done. In terms of the push me, pull you, though, and what does ultimately get voted on, I can tell you that the concern from the left is actually, it's sort of about Senator Olympia Snowe, that the focus on her potential Republican vote for reform in the end is giving her too much power, is putting her in a position of directing too much of what's going to be in the bill in order to get that one vote that the bill will become more conservative than it needs to be in order to be effective. What's your feeling about that? Well, again, first of all, I can't predict what these 60 votes will look like. We know we're going to need it. We know that people are going to try to filibuster it. But remember, Olympia Snowe has been open. Now, it's not the Schumer public option. She's been open to a trigger. She's been open to some things. She has talked about this before. But it's possible we could get 60 votes on this without her. It's possible we could get 60 votes, as you've pointed out, to move to the procedure and then have a vote on other elements of the bill that would only take 50 votes. The key is to get a bill out of the Senate and then negotiate with the House. But no one here wants the status quo. No one can do that. Not the backpack company in Minnesota that's, the guy's paying $24,000 for his family of 4 with 15 employees. Not the people that are waiting in line for health care. No one wants the status quo. Senator Amy Klobuchar, Democrat of Minnesota, thank you very much for joining us tonight. It was good to be on. And braving being in the same breathing space as me. I really appreciate it. Well, very good. Thanks. Thank you, Rachel.